Hey guys, welcome to another edition of Can You Talk Real Quick? This is where I call one expert who is covering an issue relevant to the times we're in or to your life particularly. And this one is just that. It's everybody. It's healthcare in the United States of America. More specifically, health insurance access and coverage. An issue I've been covering with health policy experts, economists, journalists, professors, physicians, people working in the healthcare field for over, I guess it's 15 years since President Obama was elected in 2008. We started talking about it on the campaign and then obviously in 2010 with the Affordable Care Act. And so today I reached out to healthcare reporter Megan Messerly, who works at Politico. Say whatever you want about any corporate media company. If they resource a reporter like Megan, as good as Megan, to cover poverty, people living in poverty, in this case, to cover folks who are getting kicked off of Medicaid, I give them credit for that because Megan's reporting is super important and really good and thorough on an issue whose impact is so serious, so vital that it should matter to every American because as many as 15 million people, including 5 million children, are expected to lose Medicaid in the coming months in what will be the largest shifts in the nation's healthcare landscape since the passage of the Affordable Care Act. Megan writes, while all states are removing people from their Medicaid rolls, several Republican-led states appear to be moving at a breakneck speed, and no state is moving as quickly as Arkansas, where Governor Sarah Huckabee Sanders has embraced her predecessor's plan to complete the work in about half the time other states are taking, an aim many fear will lead to eligible people mistakenly losing coverage. These are my words now. Republicans trying to take health insurance away from poor people so fast they won't even have time to realize it. And once they do, it will be hell trying to navigate the system to get it back, if they ever do get it back. More than 140,000 Arkansans have lost Medicaid in 2 months, most of them for procedural reasons, Megan writes, meaning paperwork. They didn't even know. They didn't get the notification. Megan Messerly covers healthcare for Politico. She drove hundreds of miles around Arkansas to find out why so many of them were falling through the cracks, and her reporting is real essential. I highly recommend you go get it and read it at Politico and follow Megan on Twitter where you can get more at Megan Messerly. All the links are in today and every day's show notes. This is my first time talking to Megan. I reached out to her and I said, can you talk real quick? She said yes. Here it is. Megan, great reporting. I hope it gets a tremendous amount of attention. You clearly put a lot of work into this. Welcome to the show. Thanks for letting me talk to you.
Yeah, thanks so much for having me.
So you've been doing this for a bit. You've been, really journalism, I guess, since high school, it looks like, according to your bio. But you've been covering these issues, specifically healthcare, for a while. And talk to me about how you actually did this reporting and why did you choose to go to Arkansas specifically?
Right. So I'll tackle the second question first. So why Arkansas? So, there's this Medicaid unwinding process that's happening right now. People have, remained enrolled in Medicaid, which is the health insurance program for low-income people. Since the beginning of the pandemic, states have not been allowed to kick anyone off. States are now going through the process of redetermining whether people who are on Medicaid are still eligible for the program. And Arkansas is doing this process the fastest. The Biden administration has told states they should take 12 months to complete this process. Arkansas is doing it in 6. That's the result of a law that the legislature passed in 2021. So they're really going through this process broadly in half the time that most other states are doing it. So that's why Arkansas, there's sort of this, a lot of folks are looking at them as possibly, the canary in the coal mine on all of this because they're going to finish this process the fastest. And so they're going to sort of be proof of what happens when you move quickly, do people fall through the cracks? So that's why Arkansas. As far as how I did this reporting, I've been talking to people in Arkansas since, earlier this year. I did a story a few months ago looking at all of this and why folks were particularly concerned about Arkansas and its approach. So I've been talking with folks on and off on the ground there for several months. The folks at Legal Aid of Arkansas hosted a clinic that I was able to go to while I was in Arkansas. So that's how I met a lot of the people who, had lost their coverage or were worried about losing coverage. Other folks I just found on Facebook. You can go on the Arkansas Department of Human Services Facebook page, and people comment things aren't going well, and you can just reach out to them. And so I found several people that way as well, just through Facebook groups and people sort of expressing their concerns and just wanting to talk to someone about them.
Yeah, well, it is amazing reporting. You spent some good time there talking to actual people and all of the, I guess, stakeholders in this, not only people who are losing access to health insurance, which is crazy to say that, only country in the world, not in the world, but you know what I mean? Everybody listening knows what I mean. But then you're also talking to all these people who run nonprofits who try to get these people connected to healthcare. You're talking to healthcare providers as well as policymakers. And so it makes for a really important, well-reported piece. But it would seem that if government is introducing a policy, a new opportunity for education, healthcare, or housing or employment, it's hard to communicate that. If they're taking away an opportunity in this case, it's hard to communicate that. People don't get the email, the text, the message. There's a million reasons why people don't get the message. Are they getting the message in Arkansas, or are they falling through the cracks?
Yeah, I would say it's a little bit of both. So, the big challenge that, I've been talking to folks about, not only in Arkansas, but across the country, is people have been told for 3 years now, ignore those renewal notices in the mail. You don't need to do anything about them. Your Medicaid is fine. And so now talking to folks, it's sort of this unlearning what people have been taught for the last several years. Their Medicaid isn't fine. They need to respond. They need to provide proof of income. And so some of this is just like a grand messaging exercise. And it's really, really hard. Folks who run Medicaid programs experience this prior to the pandemic. People fall through the cracks for a lot of different reasons. But the big one is they just don't know what they're supposed to do. And so that's what we're running into now, is that, some people don't know this is happening despite, media campaigns, social media ads, radio ads, TV ads, things like that this is happening. So one, people don't know, to look out for letters in the mail. And then two, sometimes people just aren't getting letters in the mail. I talked to one woman who told me that she updated her address, with the Arkansas Medicaid agency several months ago, and the letters are still going to her old address. Now, luckily, she's able to go to that old address and get those letters, but some people might not be doing that, and they might just be missing information about this.
I just want to give my quick anecdote and see if you have any insights on this reporting-wise, because even if you did get the message, even if you are affluent and educated and, say, have a couple of degrees, the problem is, as I'm talking about my wife and I, as we experienced, when I lost my corporate health insurance and had to get on the exchanges, it was a nightmare for us. My wife, who's much more intelligent than I am, honestly, and I'm not being paid, like she handles these things. She does a great job with these things. She broke down. And I remember her just saying, imagine, this is so hard to navigate and to figure out. Imagine if I didn't speak the language. I just remember her empathy there in that moment. But the point I'm trying to make is, even if you get the message, it's hard to navigate what's next in these cases. There are actually people who make livings trying to help you navigate that. Anything you would add to that? If you got the message, whatever's next is real hard to figure out. Fair?
It is very fair to say. When I was in Arkansas, I read many of these renewal notices. People, had them with them or brought them with them when they met with me, and I covered this stuff. I've been covering Medicaid redetermination. I know this is happening. And it was really hard for me to figure out what some of these letters were saying. I read through one woman's form, and, at first it said you're approved for March, you're denied for April. It was like back and forth, and so she was like, do I have coverage? Do I not have coverage? So some of these notices are just really, really hard to parse. And then even if you know what they're saying, it's sometimes hard to figure out exactly what you need to provide to the state to prove that you are still eligible for the program. You believe you are.
Oh, it's just so infuriating, because we're just talking about insurance. We're just talking about access to healthcare. We're not even talking about healthcare. That's always going to be complicated for everybody in every country, but we're just talking about coverage. So pick somebody that you profiled. I was going to say a name, but I wasn't sure if you could quickly reference him. But you really sat down with actual Arkansans. Am I saying it right?
Arkansans. Mm-hmm.
Talk to me about someone who fell through the cracks, or who's confused, or who's scared, that you met, that you interviewed.
Yeah. I mean, there's so many of them. One that comes to mind, as a woman I've been talking on and off with before I got to Arkansas, and met her when I was there. Her name's Erica Horn. She's a mother. She cares for, she has 2 adult disabled sons who she's a caregiver for. And she lost her Medicaid because of child support issues. So Arkansas has this law in the book saying that, parents have to cooperate with the child support process in order to remain eligible for Medicaid. And so, she did not know that she wasn't cooperating with the child support process, found out when she had gone to the pharmacy to fill her medications at the beginning of May, found out she had lost her coverage, tried to get in contact with her local DHS office, couldn't do that, kind of leapfrogged around them to get to talk to someone at the state, who then got her local office to call back. She found out it was because of this child support process. They told her she needed to call child support. Child support told her, no, like there's a form you can fill out with DHS to exempt you from this process. It's just a very confusing process. And the last time I spoke with her last week, she still didn't have her Medicaid card.
And it's like that list of things that she just had to do and then you had to run around. It's hard to color it with, articulate that during all that time, her life was happening. And like maybe someone called back or maybe she had to be on hold. We all know what that is. It's just so challenging. So generally, your reporting is generally about what's happening in the states, and you understand certainly when it comes to healthcare and the efforts that are being made. So my question is it fair to say that Republican politicians at the state level are doing what they can to unwind Medicaid or cut Medicaid, which is health insurance for people living in poverty, and Democrats are generally trying to expand Medicaid? We all know at the national level, Obamacare had a clause in it for a Medicaid expansion. Supreme Court, some states did it, blue states, some states haven't, red states, but some red states have as well, it's fair to say. But is that a fair characterization of what's happening at the state level, that Republican politicians are openly campaigning on reducing insurance coverage for people living in poverty, Medicaid recipients?
A lot of Republicans, I would say, are still see a very, I would say, limited vision for the Medicaid program. So you think about what Medicaid traditionally covered. It was children, it was parents, it was, sort of the folks who I guess states perceived as like particularly vulnerable and in need of healthcare. And as you mentioned, the Affordable Care Act, there was Medicaid expansion, which sort of filled in this gap in coverage for folks. That sort of the childless adults is what they're known as, but, low income people who didn't qualify under one of those other categories. And we saw then, and we still see now, a lot of Republican opposition to that. Like you mentioned, some Republican states have expanded Medicaid, come to embrace Medicaid, including in North Carolina, where, the Republican-controlled legislature, passed Medicaid expansion earlier this year. So there's been some softening, I think, toward Medicaid in that sense. But broadly, I think we still see a lot of concerns and skepticism about whether Medicaid is meeting the needs of, the people it was intended to. And there's, I think, some argument about, among Republicans, there's some argument about, who should be eligible, right, for this program, which is why
the idea that we're arguing about who should be eligible for health insurance coverage, just want to put that out there for listeners. That's the argument. Who should be eligible for health insurance coverage? And I know somebody who lives in Michigan who has severe depression, can't hold down like a good job, even though he has a bachelor's degree. He does pizza delivery. He reported like $25,000. This is Michigan. They have much better Medicaid coverage. And he now just got kicked off. It's making too much money for Medicaid as a pizza delivery person. And he has all these issues. It's just, so I'm talking about a blue state like Michigan, just to paint that. And it's an anecdote. And I'd like to think it's somehow he fell through some kind of crack there. But going back to Arkansas, you talked to an actual Republican lawmaker who is also, I believe, a pharmacist. I'm forgetting his name. What was his view on what they are doing there?
Yeah, so he's a freshman representative. His name's Brandon Anker. Yeah, so he's a pharmacist, and he had kind of an interesting perspective on the issue because he serves, his pharmacy serves some Medicaid patients, a pharmacy he worked at previously served an even more Medicaid population, and he's seen sort of the impacts of this firsthand. He told me that, for him, the realities of people on Medicaid is debating between, should they get their insulin or should they buy their kids inhaler, that kind of thing. And so he's really seen how people, struggle to, one, afford their medications, and two, keep their coverage on Medicaid. So, he said that they are seeing some of this in their pharmacy so far, and they're trying to help people get them re-signed back up for coverage. And, I asked him, he wasn't in the legislature when they passed that 6-month law, but I asked him, do you support that? And his argument was, thinks people are going to fall through the cracks either way, whether you do it in 6 months or whether you do it in 12 months, and he told me he is concerned about people falling through the cracks, but that his argument was that's why, pharmacies, that's why the state, that's why, all these different groups need to be doing all they can. I think the argument you hear from folks who are concerned about the 6-month time frame is that if you do this over 12 months, there's just more opportunities to catch people who are falling through the cracks, right? Like, you think of all the community resources in a state like Arkansas, right? If you spread out their, availability over 12 months versus 6 months, they're just going to be able to help more people. And so, we have seen this sort of debate over whether that 6-month time frame, is or is not the correct way to approach it. But I would say Republicans in Arkansas believe it is. And the governor and others have made this argument that this is about fiscal responsibility. This is about freeing up resources for the people who need the most. And then you hear people on the other side saying, okay, that's great. We understand that, people who aren't eligible for Medicaid shouldn't be covered. But, we're worried about this process moving too quickly.
I'm just looking up, and probably should have been the first question, and if you covered this, sorry. Did Arkansas allow for the Medicaid expansion from Obamacare?
They did, yes. So yeah, they actually adopted it pretty early on under what's known as the private option. So they have this sort of unique model where they're actually, they pay for premiums for like Obamacare exchange plans for people to be covered under Medicaid. So, but they do have Medicaid expansion.
Anything I haven't asked that you want to mention from the article? Looks, at least on social media, like it's getting a lot of attention, which again, I think is really important because this is an issue that obviously affects people living in poverty, and it's, Politico funding and resourcing your reporting, I think is very important. I'm glad you did it. But anything I haven't asked, or any reactions to it that you want to mention or address to your reporting?
Yeah, I think the only other thing I would say is that while this story, is focused on Arkansas, this is happening everywhere, and the data that have come in so far are from generally Republican controlled states because they have begun this process the fastest. And so we're just seeing blue states now start this process. But talking to a lot of folks, there's concern that people are going to fall through the cracks everywhere. Like I think of California, they've implemented this process. So like people who are transitioning from Medicaid expansion to the Obamacare exchange, it's supposed to be as seamless as possible. Like it's supposed to be literally like as much of a one-click process as possible. But people are concerned, even in states like California, you mentioned, your friend in Michigan, right? There's concerns that people everywhere are going to fall through the cracks. I think that's why folks are looking at Arkansas to see okay, what's happening there. And what does that mean for what we're going to see in other states? And what can we do to prevent, as many people as possible from falling through those cracks?
Such vital reporting. I guess my last question, though, is, when you're looking at the United States Congress, do you cover U.S. Congress health care policy?
I don't. I cover states.
Okay, because I was just going to, it feels like I covered this issue forever during the Obamacare fight. Years, really. And so just as an observer, it would seem that we're not talking about health care as much, except for as it relates to women's reproductive rights, women's health care around the abortion issue and mifepristone and everything around that. I feel like, so this isn't data, we're not seeing much in terms of legislation being campaigned on, and I'm even going to argue at the state level, much less the national level in terms when it comes to healthcare. That's what I feel. What do you think of my feelings outside of women's reproductive rights?
Right. So, I mean, one, there are things happening in Congress, but it's a divided Congress. So that sort of limits, what can be done. On the healthcare front, like you mentioned, there's a lot happening in sort of the reproductive health space. We've seen blue states, try to take steps to expand access to birth control or codify access to abortion or things like that. we've seen some, I would say, like nibbling around the edges of healthcare in the states. There's been a lot of movement around a public option, right? So people could sort of buy into Medicaid or buy into public health insurance option.
I got to look into that. Okay, great.
Yeah, so there's a few proposals. It's been passed in a couple of states, but sorry.
Well, I'm going to DM you for any links on that, and I'll include that in the show notes because I had no idea about that. But yeah. Oh, really good. And anything else that you've been covering a lot of the women reproductive rights and access, right? And a lot of your reporting has been focused on that this year. Fair to say. It
has. Yeah. We're coming up on a year now from when the Dobbs decision came down. And so, yeah, given that I cover state health policy, a lot of what I've been doing is tracking that and, fights in the legislatures over when and whether to ban abortion and exceptions or no exceptions. And I think a lot of folks maybe on the right, thought once Roe was overturned, it'd be sort of easy to restrict abortion access. And I think Republicans are finding that there's a lot of differences and a lot of difficulties, challenges, debates among themselves in the post-Roe era.
I'm going to reach out to you, try to book some more time to talk about that and your reporting on that. Really important. Megan, thank you so much for joining me. Great stuff. And please keep up the great work. We appreciate you talking to me today.
Thanks so much for having me.
Well, there you have it. Megan Messerly at Politico. Read her there, Politico.com, and follow her on Twitter. Let her know that you heard her here on the show because it's the first time that she's been on the program. Find out more about her and her excellent work in the show links for today's episode of Can You Talk? Support the show with paid subscription. Always welcome and needed. Patreon.com/Pete Dominic. Thank you so much for listening to today's episode of Can You Talk Real Quick? And don't miss the regular episode of Stand Up with Pete Dominic. Bye-bye.